All right, here we are. Here I am. Here you are. And this is my seventh breath to breath interview. It's a very special one, very meaningful to me because I actually am interviewing myself. I'm sharing my breath of origin story, and I get to tell you why I do what I do. It felt very fitting because I've also been in business for 7 months now with Breathe Well, Be Well. And what it also comes to a head is it has been 7 years since I last took Adderall. And that was a big part of my unlearning, a big part of starting to get curious as to what I need to be successful, healthy, and thrive. So, with that, here we go. My name is Karen White. I am a breathwork and meditation and yoga instructor. I've been a speech language pathologist for over a decade. I also am a certified oral facial myologist, and I'm the owner and operator of Breathe Well, Be Well. I really pride myself on teaching clients and patients how to breathe, how to use their breath, their thought, their body in ways that are going to help them feel more secure and safe just being in this one body that we get. And it comes from me not doing that for a really long time. So let's go all the way back to when I was a child. Really cute kid, obviously, but my mouth was always open. I had a really hard time swallowing pills. I would hiccup and burp a lot. I always was tired, like really tired, fatigued. Now I was active in sports. I played soccer all throughout middle school and high school. I also had a really stable home. I got enough hours in bed, and I was made sure to have a place to sleep, make sure I had meals. I had a really healthy routine, but still tired. Not so much the fact that it was medically alerting, but just that things were hard because I was very fatigued. And even so much so that in high school, you were looking at most likely to fall asleep during graduation, which is not really a superlative. It was just made up for moi. Um, Funny until you start understanding, oh, this is a cry for help. I would sleep with my mouth open. Additionally, swallowing pills was horrible. Basically, it was non-existent. And a really funny story. Oh, also chronic ear infections, lots and lots of ear infections. These are all connected, by the way. So that's why I'm bringing them up. I can remember a story when we were at a dude ranch in Texas, and I got another ear infection. And my sweet grandmother drove an hour there and an hour back to pick up an antibiotic. And she wanted to murder me when I told her I can't swallow pills. Peanut butter and baked goods were my best friend to trick me into swallowing. Spoiler alert, it's because I was tongue thrusting and did not have a proper swallow pattern. So let's move on. I get into college. I'm a sophomore. My parents divorce, and I'm having a really hard time with it. You know, we all have different things in our lives that are challenging. And in fact, life is full of challenges. That and change are about the only things that are guaranteed. Challenges and change. And it's not that things are supposed to be easy. It's just we get and need and learn skills of how do you handle certain struggles? How do you handle, as my friend, hope you don't mind me calling you a friend, Martin McPhillamy, who I interviewed. He was talking about eustress and distress, and you need a certain amount of eustress, which is the stress and the challenges that you intentionally tackle so that you grow strength, you grow more emotional fortitude. And I just wasn't prepared. I wasn't prepared. I didn't know what to do. I was all the way out in Texas. I'm from South Carolina. I literally just was exhausted. I was tired. I was sad. Everything that I'd known was changing, and the help that I ended up getting was Adderall. So Adderall was prescribed to me from a psychologist. I was diagnosed with ADHD, the hypoattentive, meaning I was very lethargic, not engaged, not necessarily bouncing off the walls, but also we understand that all of these diagnoses can present themselves very differently in all types of individuals. But what I would say is sleep was never addressed. Airway was never addressed. Coping skills for stressful situations was never addressed. So this started when I was a sophomore in college, about 2005. And this began a 10-year relationship to Adderall. The first 5 years, great, because I now had a Band-Aid. I had this Band-Aid that worked instantaneously. And I had plenty of it. What I think is so fascinating now when I look back, and especially being a myofunctional therapist, speech language pathologist, I love patterns. And what I realized is the pattern that I learned was things are hard, take a pill. You're tired, take a pill. Something is upsetting and you want to literally suppress it and go on your day and pretend like it's not there, you take a pill. Now, these patterns worked in that very moment. It took me away from what was challenging and what was hard, but the underlying issue is never addressed. We've got to be more curious. We've got to be excited about understanding our bodies. We've got to be able to listen to our bodies. And none of that was happening. I learned really, really strongly, or the message came really strongly, disconnect, disengage from your body. Live in your head, get whatever's done, get whatever's in front of you done, and just keep plowing through. So like I said, the first 5 years were fine. I definitely started noticing changes in my tolerance. I grew an extremely robust tolerance to Adderall, which meant you increase it. The last 5 years, I was in graduate school and getting my master's in speech pathology. In the meantime, there's lots of meantimes. Also, this is raw. I'm just saying it. I'm just telling you. I want this to feel more like a conversation of my experience because this is what happened. And there's so much. I have a hard time remembering all of it, so I'm working on it. But anyway, and I want to say is either college or graduate school. My father, who is a retired dentist who specialized in sleep medicine, he was the one that really started planting the seeds of my functional therapy. We've got to look at your mouth. We got to look at your sleep. I knew what sleep apnea was before I even knew what speech pathology was. And yeah, I think this was all I was still in Dallas because that's where I went to SMU in Dallas. And I was able to get a sleep study because I'm still tired. The Adderall's not working. I'm working with psychologists. I'm working with trying to take the right prescription, and I'm just needing more and more and more. Meanwhile, I'm also starting to add in smoking. I'm starting to add in as many Red Bulls and coffee as I possibly can. The pattern there being let's up it, because my body is so low because it didn't have the sleep it needed. It didn't have the rest that it needed. And so I'm just constantly trying to fill it with these uppers so that I can be present and engaged. So with that, I was able to get an overnight sleep study at a sleep lab, and they kept me the whole night. They didn't find any apnea, and they kept me during the day. So if they don't find apnea at night, they kept you during the day where you would be awake for 2 hours and then you would get to take a nap. And then you'd be awake for 2 hours and get to take a nap, and they want to check how quickly you fall asleep. So no apnea, but they found me to have idiopathic hypersomnia. And I don't even know if they still use this diagnostic descriptor anymore, but idiopathic meaning they do not know the origin of this pathology. And hypersomnia meaning I'm really tired. So in a nutshell, They don't know why I'm tired. Was the airway addressed? Mm-mm. Mm-mm. I mean, they took my blood pressure, which I was always scared of because I'm a smoker at this point and heavily used Adderall. And that's a whole nother issue. But so what did they do for idiopathic hypersomnia? Oh, the treatment is more Adderall. So now I have 2 prescriptions to Adderall. And in my head, I'm like, gold mine. Great. I can sustain this forever. And of course, you're young. This is my 20s. I don't understand the longevity of your life. You don't understand that these are not sustaining practices, sustaining patterns, sustaining habits. These are literally in the interim where I am just starting to get bigger and bigger and bigger band-aids. And they have to get bigger because what I have is not covering up the wound that I am just further digging. So as I am like creating this facade of everything's okay, I'm okay, body, what body? We just have to be awake. We have to be stimulated. We have got to be go, 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 go. So 2 prescriptions. I'm well into like the second half of my 10-year Adderall usage. I was able to graduate graduate school and again, just have awful coping mechanisms, awful skill sets. I learned all the wrong ways to handle stress, but I was getting my work done. I was going to now my job. I was taking the prescription that was prescribed by a doctor. And in the meantime, I'm just slowly deteriorating. And what I can tell you is my parents knew. They knew something was wrong, but I'm an adult by now. I'm an adult and I get to make my own decisions. But my mom, my sweet mom, she convinced me to start therapy, and she tricked me. She's a smart lady. She tricked me saying it's just normal therapy to see how it goes. But what I didn't realize is she was having me go to Hope for Families. And Hope for Families, Amber Campbell, if you are in the Greenville area and you are struggling with addiction, you have a family member that's struggling with addiction, you have denial of someone in your family, or you are that denial person, Hope for Families. They taught me skills I never even knew that I needed until I really needed them. But what they offered was an intensive outpatient program. So you are looking at what recovery from Adderall looks like. I went into rehab. I quit speech. So I graduated graduate school. I was working as a speech language pathologist. I've been for a couple of years now, and I just knew my life was not sustainable. I was staying up multiple nights. I was not taking care of myself. I literally was smoking, probably a pack, maybe 2 a day. Loved me some real Cokes. Loved anything that had caffeine or sugar or anything that gave you that boost. And then I would immediately crash. Sleep is horrible, non-existent. Yeah. So all of these things create this situation where in 2015, I finally realized I have nothing left to give. I have nothing left to give internally, externally, mentally, spiritually, any of it. So I say, okay, I take a hiatus from speech, from practicing speech pathology. I enroll in this intensive outpatient recovery program at Hope for Families. I go to therapy. I do that twice a week. And then I also go to individual therapy sessions 1 time a week. And I just start from scratch. And let me tell you, I don't even know how to describe how awful, how awful it was. What I can tell you is showering was hard, doing any activity was hard. I had taken anything that I had, all of my supports for functioning at that point were stripped away. And they had to be to fully get it out of my system. And through the skills that I slowly started learning through group therapy, through intensive outpatient, that program, going through rehab for a prescription addiction that basically took away my ability to understand myself. I learned how to talk to people. I learned how to listen. Listening. Why is that so hard? Listening to ourselves, listening to other people, listening to just what is happening. Not having to respond, or react, but just listen, just sit and listen. And I would say it took at least a solid year of going through that. And very humbling, got a job at Swoozy's. They probably thought I was insane when I was like, I can work all these days except for the 2 meetings, very important meetings that I have these times during the week. So they're like, okay, so sure, come work here. But you just build back. You build back. So you burn it down. You start from scratch. I slowly start to build back how to listen to myself, how to listen to my body, how to actually deal with stress, how to identify and name these emotions that we're having. So these emotions, these thoughts, they are still in our body. They are still a part of us. And what really is groundbreaking is it was depression. I was so depressed in college because I was having a very hard time in that situation. It was situational depression that was misdiagnosed without the proper support, misdiagnosed. And then also, let's talk about what causes depression too, or what can basically be the gasoline on top of it, and that's poor sleep. So I've gone through rehab. It's been about a year. I'm slowly building back. I start to add some speech therapy, contract work, and get back into it because I love speech therapy. I love helping other people. That's always been something that I adore, and I'm good at it. So that feels right. That feels good. Building up. In the meantime, there's a course on myofunctional therapy coming to Greenville, where I'm from. And it was sponsored through the International Association of Myofunctional Therapy. And I was like, you know what? This is something I'm interested in. So I start that course. And what I know now is I realized my tongue's not in the right place and I can't swallow correctly. And I'm a speech language pathologist and the daughter of a dentist. But I'll listen to these studies and I'll start trying to teach it to other patients, but I can't do it. So I kind of halfway believe it. That was my first introduction to myofunctional therapy and correct oral rest posture and swallowing patterns. And then I get further along. I still have this information that I've learned, but I don't fully believe it and integrate it because there's still such denial in my body. And just a second and a little sliver on denial. So when people get defensive, it is protection mechanism. I knew, whether I was ready to admit it or not, there's something wrong with my swallow. There's something wrong with the way my tongue wants to rest because I can't do these things that I'm being taught is normal. And it's not that I was broken or I was unworthy. I just was scared. So if I can't swallow the way I'm supposed to be teaching clients to swallow, what does that mean? And I wasn't ready to answer those questions. I wasn't ready to dig deeper. I wasn't getting curious because I was scared. So literally in my head, I remember thinking, my functional therapy is bullshit. And what I really was saying was, wow, there's a really big problem. And I am not ready to ask it, to hear it, to listen to the answer, because I didn't know what the steps would be to fix it. So a lot of times we stay stuck where we are because we are scared to admit there's something wrong. And we're scared that we're not going to know the path. We're not going to be able to find our way out. We're not going to have support. So just keep that all in a nutshell. I still keep practicing speech. I'm getting pretty good and not being an Adderall. I slowly gave up smoking. That was another year after giving up Adderall. So 2005, no more Adderall. 2006, finally gave up smoking. And it wasn't till like dates are hard. Dates are hard. It's a lot when you try to think about the story of your life. But I slowly started understanding there is something else. And oh, I know. I kept getting strep throat. So I went to an ENT and they said my tonsils were huge. Also, I had a deviated septum and enlarged nasal turbinates. Well, I've been learning about these things with myofunctional therapy as I'm continuing to expand and get more curious and finally being open because my body's stabilizing from being on all these crazy medications for so long, so that I actually had enough clarity and thought to say like, okay, I'm ready to handle a little bit more. So I booked the airway surgery. I get my tonsils taken out. I fix my deviated septum and I reduce my nasal turbinates. And when those plugs came out of my nose and I took that breath, really my first breath for the first time, it makes me want to cry because that's the first time that I realized there's a different experience than the way I have been living. I'm going to call this my gateway breath because that was the first time that I realized, oh, just because this is the way I know it to be true doesn't mean that there's not all these other possibilities. And when I realized I had never been breathing deeply, I had never been able to use my nose fully to its capacity. That was the first time that I was like, there is something major shifting inside. And as I continued healing from that, I also, in the meantime, am learning about tongue ties, lip ties, buccal ties, learning about the whole orofacial complex. And it's finally starting to click from what I learned at that very first myofunctional course. What the heck is happening? And I'm learning that my normal was dysfunctional. It was normal to me, so normal is all relative. It was not thriving. It was not functional. It was barely getting by. So all those times that I couldn't swallow a pill because my tongue couldn't lift up, all those times that my mouth was open and I wasn't using my nose, I was using my mouth to breathe when I was asleep and awake, it's because I couldn't keep it closed. And I get my tongue tie release, I get my upper lip tie release, and my buccal ties release. So now I have a nasal passage that works. I have more room in the back of my throat. There's not as much obstruction in my nose. So my nose works. Now I'm finally rehabilitating all these oral structures. So I'm getting things on track. So that I can actually use this to breathe. And it's about that time that I started working like solely at a myofunctional therapy clinic. And I'd like to give a huge shout out to Chrysalis Orofacial because this is the home that I had for 2 solid years that allowed me to expand my skill set and my understanding and my knowledge of what myofunctional therapy was. And what I really was doing was trying to make sure I can do it. Because if I can do it, I can teach it. If I can do it, I can believe it when I say it. And also, I want to feel better. So the depression was absolutely exasperated by poor sleep. And what I'm talking about poor sleep was essentially my tongue never rests up in my palate. That's where it should always be, unless you're eating, talking, or drinking. Tongue up, lips closed, using your nose. So when that doesn't occur, our palate, which is up here, if our tongue is down here, this starts to get smaller and smaller, and our septum becomes deviated, which only increases the difficulty to breathe through our nose. So you take 3.5 decades of dysfunction, of course, things are going to get chronically worse. Now, the rate at which they happen, the rate at which these things occur, I don't know. I mean, everyone develops differently. There's so many factors that come at play. Is it the sinuses, or did you get a cat and you start breathing through your mouth, or do you have a tongue tie, or do you have like TMJ? Do you get hit in the nose? There's so many things. But for me, my tongue was never in the right place. It deviated my septum. It caused a smaller mouth, which then makes it harder for you to keep your tongue up. And that also creates forward head posture. So forward head posture is your body just trying to open up your airway. And as I'm learning about these things, as I'm fixing these things in myself, I start to understand, oh, you can breathe better. You can rehabilitate your swallow. You don't have to thrust your tongue forward. You also can sleep better because now you've created a pattern during the day which you can keep your tongue up. You can keep your lips closed. You can breathe through your nose. We practice this during the day so that we have a plan at night when we're asleep, unconscious, and on our back. If our tongue is not strong enough to stay up during the day, how is it going to stay up when we are literally on our back? And that is where things collapse. So I didn't have sleep apnea, but I had upper airway resistance. And that is from a lack of flow in my nose, a lack of room behind my throat, inability to breathe deeply. And also, I probably never had breathed deeply. I was always taking shallow breaths. So the swallowing, the breathing, the inability to sleep, the difficulty sleeping, all of these things, they are all correlated. And then the pandemic happens. I go and get my yoga teacher certification. I don't know why I'm getting it. I just know that I need it. From there, I'm like, I'm not going to teach, but I learned some pretty cool breathing exercises through this training program. And I get curious. I get a breath coaching certification. Also, I get the Oxygen Advantage, the functional breathing instruction. I'm coming for you, the advanced course, FYI. It's on my list. It's on my list of future goals. But I get that baseline and I start using it with patients. And I start realizing another pattern. Not only was I breathing poorly, but I'm seeing such poor breathing in all my clients. And we have got to get our foundation firm. We have got to bring our respiration, our breathing first and foremost. Anytime that you're dealing with any mental distress or diagnosis, look at the sleep. Because you want to know what makes anything worse? A really bad night's sleep. And what makes that even worse? Decades of it. Decades. So what I know now is I get to be curious and I get to listen to my body and I get to ask questions because we can sit in the unknowing. There's things that I still want to work on and there's things that I don't fully understand, but I'm okay with not knowing the answer because I know that it will arrive when it's time. I also know that I love that I can share this because I want you and you and you and you, I want everyone to understand that addiction is a cry for help. Addiction is a Band-Aid. And Band-Aids have a place, but they do not heal the wound. And if we want to actually be sustainable and if we want to be thriving, we have got to look at the wound and say, what does that wound need? What is its message? What is it here to tell us? And what I can tell you for me is my airway was screaming for help, but I didn't know what I was looking at. I didn't know how to interpret the messages, but you better believe I do now. And you better believe that I share it with whoever I can because you don't need to go through this whole ordeal to be able to breathe better. That is our gift. We get to breathe deeply. We get to be aware. We get to change our patterns so that we can be okay with sitting with ourselves. So breathe slowly. Be okay with stillness. Learn that you have safety in your body. And when things are alerting you and we feel dis-ease, understand that there's a reason. We don't always know the reason yet, but there is. There's one. This is just my story. And it's only begun, because once I started seeing these patterns in my patients, I realized this is what I love. I've got to teach people how to breathe, because this is a fundamental skill set that literally helps us be okay. So I started Breathe Well, Be Well in February of 2022. We're looking at 7 months. This is my 7th interview. This is my origin of breath story, and I am 7 years clean from Adderall. I can tell you that addiction, though, there's so many different shades of it. Sometimes I buy too much on Amazon. Sometimes I get too obsessive about my food. Sometimes I buy literally 5 pairs of the exact same leggings because I love them. I mean, I can tell when I'm trying to push and suppress and dissociate, but now I have the skills and the awareness and the support to recognize it and sit with it. So, takeaways. Choose, take your pick. But what I can tell you is get curious about what your body's doing. Forget critical. That has no place. That has no place. And in fact, that is us shutting down and not listening. So be curious, listen, learn how to sit with yourself. Also, look at your airway. Can you breathe deeply, or is it up here in your chest? Can you breathe slowly, or is it rapid? Is your nose working? Did you even know that you're supposed to breathe through your nose? Is your tongue up? Can it stay up? Do you sleep throughout the night, or do you wake up? Do you move around? Do you toss and turn? Do you snore? And know that you are never too late. So I didn't fix my issues until 3.5 decades of life. And I'm still working on them. I'm still trying to hone in and tweak my sleep. There's definitely some residual things left over from this interesting thread of events that I've told you. High blood pressure, getting there. I think I know it's from my adrenal glands just still on high alert. They're slowly calming down, but it takes time. I also know that I listen to when my body's talking to me. And if I'm tired, I rest. I go to bed early. I do steps and take steps that help me for the next day. So if I choose to do something now, just understanding that that's either going to take away or add to my tomorrows. I also would say your story is not shameful. There's a long time that I felt a lot of shame about being addicted to Adderall, being a smoker, going through rehab. And now I cannot be more proud, because I want you to know that you're not broken. Your story isn't shameful. You have worth and you have value. And everything you are going through is teaching you, sometimes in really hard ways, but it's teaching and showing you that you are worthy. Oh, it's a lot. Full disclaimer, if you're struggling and if you need help, seek it. I'm not an addiction specialist. I am just sharing my personal testimony, my personal story. And by all means, it's always a combo. So if you take Adderall and it helps you and that is working for you and you're under the care of a physician, great. It's never a one size fits all. No medication is, no regimen, no routine is. It is very much what is working for you. And I support you. I am here for you. And I'm holding space for each and one of you, each and every one of you. So with that, I think we wrap it up, because That's enough. That is enough. So here I am, Perrin White. I'm your new breath friend. I get to show you how to breathe. I get to show you how to take your deepest breath, how to quiet your mind, how to address your emotions, how to support them with meditation. And we get to work together as a team for this closed system. So if emotions are stealing your breath, you listen to them and support them. If airway obstruction is stealing your breath, you get it fixed, you retrain yourself, you learn better patterns, and you keep going. You keep digging. There's a three-part mantra that I always end every yoga class with. And I think that's fitting that we do that here. So it's been an honor having you. It's been an honor sitting with you. And it's my hope that you continue to live with intention, to move with gratitude, and to never stop breathing.